So my name is Latrice Rollins. I'm honored to serve as the director of the National African American Child and Family Research Center. I'm joined by my colleagues, Jeree Stroud, who is one of our capacity building co-leads and really kind of helps to administer and direct one of the projects under our capacity building section, which is the Community Pilot Project Program. We also are joined by Michelle Meadows, who is the research administrator for the center. You can go to the next slide. So we're going to talk about just a brief overview of the African American Child and Family Research Center, and then go into more details about the program. So our mission at the center is to provide national leadership and excellence in community engaged research, which will better serve African American children and families. Our goals, we have 3 different areas. So as I already mentioned, the capacity building area, but of course, as a research center, we do research. And so our goal is to advance a community engaged and high caliber research program that is focused on African American children and families. And so our objectives there are really to have this interdisciplinary agenda that's really looking at ways that we can inform the Administration for Children and Families, or ACF, to inform their programs and address any concerns that they have, as well as with this being a community engaged agenda, we want to make sure that we address the concerns of the Black caregivers that we hear from, and make sure that we are meeting their needs and also lifting up any concerns that they have about these programs. So we collaborate with the community and partners to really develop and implement our agenda. Next slide. With the research capacity goal, we're looking to develop tools, resources, and approaches to equip the field to conduct relevant research, specifically with African Americans, and making sure that that research is rigorous and that it's informed. And so this is one of the, again, one of the programs that falls under this bucket, the Community Pilot Project Program. We are here to provide consultation, professional development, and really support and encourage the work of researchers. And that includes those who are in community-based organizations like yourselves. We also have a mentoring program called the Emerging Scholars Program for undergraduate and graduate students who are interested in doing research, and they are in some of those health and human service fields, such as social work or public health, education, public administration, but really wanting to diversify the research workforce, and making sure that they have opportunities to be exposed to the type of research that we do here at the center. Next slide. Our final goal is around communication. And so we're making sure that everything that we're doing research-wise and various resources, that we're getting that information out to diverse audiences, such as our community, our other researchers, the agencies and that we work with, students, as well as policymakers. And so there's a number of different ways that we want to make sure that our research products and resources are communicated to those audiences, including the conference that I just talked about a few moments ago. Next slide. So as I mentioned, as a research center, we do have specific priorities that we are looking at. We're looking at defining and measuring the needs, assets, and experiences of African American children and families, as well as looking at some of the barriers and facilitators to these families receiving services through particularly the Administration for Children and Families programs. But beyond looking at those needs and assets and all those things, we do want to know what works. We do want to talk about solutions and strategies. So we do plan to conduct research around strategies that will promote well-being, particularly for Black children and families. And we're also looking at promising approaches to service provision. Next slide. And I mentioned this already, our priority areas are solely around TANF, so temporary assistance for needy families, looking at poverty alleviation and various self-sufficiency programs, and then early care and education, which focuses on Head Start, early Head Start, and childcare assistance programs. In terms of doing our research, we do have some guiding principles to make sure that the research that we do it is fair and it is equitable, it is ethical as well. And so we want to make sure that what we do in terms of our methods, that they're rigorous, We want to make sure that the research is relevant to our communities, but also relevant to the Administration for Children and Families priorities and their concerns. We want to be transparent in the work that we're doing. We will be independent in terms of the, not being biased in terms of the ways in which we conduct research. And like I mentioned, being ethical. So these things guide the work that we do. Next slide. We also have what are called community values. And so again, developing this community engaged research agenda, we are led by these values that really undergird all of the work that we plan to put forward. And so making sure that the work that we do, understanding that all people have a right to self-determination. And so whether it is participating in the research or not, we want to make sure that we honor and respect that. We know that the community has a right to participate as an equal partner at every level of decision making. So that is from the beginning of a study all the way to the sharing of results. The community has the right to participate in that. And making sure, again, being ethical, making sure that folks are informed, consent to all of the processes in terms of research, that folks are aware of everything that is happening and everything they're being asked to do, and what will be done with the data. All of those things we definitely follow. Making sure that our research processes and those outcomes, that they are mutually beneficial. So we understand, yes, as a research center, we've been funded to do this work, so we benefit in that regard. We also want to make sure that our community benefits from the work that's done. So these are just, again, a number of values, making sure that we have productive partnerships, making sure that people are not just doing research projects just because there's funding here, but we're building long-term relationships and that will last beyond this research project. And beyond this research center, making sure that community members are empowered to initiate their own research projects. So again, that is kind of the value undergirding this community pilot project, where you all are able to identify your own needs and your own research questions and things that you're interested in researching to inform your own programs and policies. So our community pilot project program is designed to, again, build your capacity to conduct research and make sure that it's something that's responsive and relevant, particularly to the African American children and families that you serve. The first phase of the project, this project will start in September of 2024. And the first phase ends in February 2025. During that time, we're looking for the projects to have really solidified their idea, their research idea, which of course we would support and make sure that you're able to do that. But you would have a one-page summary just of, finally what it is that you plan to study. We will support you in making sure that you receive human subjects research training. So again, kind of making sure that we're ethical, making sure that we are transparent and rigorous in our process. You have to undergo this human subjects research training. And so our institutional review board that oversees all of the research studies that are done at Morehouse School of Medicine, they help us by providing this training to our community partners and you all, if you are selected to be a part of this project, they do the training with you and provide a certificate so that when you submit your protocol to our institutional review board to be approved, they know you've gone through the training, you understand what it is to make sure that participants are properly consented and informed of the research, and they know that you will, practice the research and carry it out in an ethical way. So those things are required, and we'll go through that training during that first phase and also help you to prepare the study protocol that has to be submitted to our institutional review board. So the second phase is simply carrying out the study, what you propose to do. So whether that is doing surveys, interviews, focus groups, any other, whatever you plan to do in terms of collecting data to answer your questions. And then every year during our annual conference, there's a presentation of results. And so you all will see when you go to our website to look at this year's conference, you will see that there's a pilot project showcase. And so that's the opportunity for our pilot projects to share what they learned and kind of what they found out from the research that they conducted through this program. And so just that presentation and then a brief report of the results will be due, and just kind of what you plan to do next in terms of the research. The report is not anything extensive, and it can be a number of different formats. So we have some folks who have done really elaborate launches of a report and had a graphic designer to put together a nice summary of their report. We have some pilot project participants who are doing a journal article and submitting it to a journal. And then, it really is dependent on what would work best for you and what you need, but we're happy to support whatever format you would like that report to be in. So our capacity building core is led not only by Jeree Stroud, who's on now and helping to advance the slides for me, but also Dr. Robert Mayberry, who is the director of the Morehouse School of Medicine Research Design and Biostatistics Core. And so he is available to help if you all have questions about your research design, if you have questions about analyzing your data, or anything like that. He is on board to do that, and has a core of professionals who can support the pilot projects that are participating in this program. We also have content experts in the fields of mental health, in the fields of wealth and economic mobility and early care and education. These are our investigators at the center, and they can certainly, be content experts to guide you in your project if you need that type of support. So to be eligible for our pilot project program, you have to be a community-based organization. So when we say community-based organization, these are nonprofits that have 501c3 designation or some other form of 501. Basically, you need to be in the community. You need to be a nonprofit, not a hospital, not an academic institution. You have to be a community-based organization. So it is important for us that we are, again, equipping and building the capacity of these type of organizations that are working closely in community, working closely with African-American families to be able to collect and disseminate their own data. And so it's fine if you are at an academic institution and you're partnering with one of these community-based organizations, that's fine, but the funding is going to go to the community-based organization. So we will award 3 community-based organizations $20,000 for the 12-month period, and it would, as I shared, start in September of this year. We do ask that you submit a budget with your application, and we'll go through some of those details, but basically, the only thing that is not included is equipment or some type of rental cost for off-site facilities. We do have an intent to submit. This is not required, but it just gives us an idea of what type of, how many applications we may receive, and give us an idea of the types of topics that folks are looking at, and may also help us to guide you if you may have some questions about whether or not your work is aligned with the center's interest and priorities. To be able to see that intent would be helpful. So that is due tomorrow at 5. And so you can submit that to our email, info@naacfrc.org. All of this information is on our website on the Community Pilot Project Program page. If you don't have that already, you should have been taken there to register to get here. So, but all of the information with the application, where to submit this intent, all of that information is there, but it is due to us tomorrow by email. The actual application, I'll walk through what it entails and what we're looking for and how you submit it. And so you can do a cover letter, which is just general in terms of, letting us know who you are, your address, that type of thing, just kind of general information. But the actual proposal narrative is a description of the community that you serve and the priority area that you would like to address. And when we're saying priority area, that is the center's priority area. So are you looking at economic mobility? Are you looking at poverty alleviation? Are you looking at early care and education? Are you looking at childcare? So those are the types of, when we say priority area throughout that, that's what we're referring to. So the next part of the proposal narrative would be to explain how your study would address that particular area and talking about how your particular experience within your organization really lends to addressing that particular area. So do you have previous experience working in the early care and education space, previous experience dealing with self-sufficiency topics and things like that, that would, again, kind of note your ability to carry out this project. And then just basically describing your interest in conducting community engaged research. Why are you interested in doing research? Why would this be important to do for your organization? Next slide. I already talked about the budget. You would definitely, there is a template for the budget, again, on the website, if you needed one, to kind of lay out your budget and as well justification for the budget. You do have to submit your organization's 501c3 status, kind of proof of that. You can submit resumes of your team members, just so we have, again, an idea of the capacity of the team. And if you are, and this is not required, but if you are partnering with a faculty member or someone from an academic institution, just their bio sketch or curriculum vitae or resume, as well as a letter of commitment that they're going to work with you on this project. Something new this year that we are trying, instead of just having only written responses, you can also submit responses via audio or video. So if you wanted to just, talk about your organization and just talk about the work that you want to do, if you want to do a video showing us your community and, whatever, we're open to those kind of diverse forms of expression. And so, yeah, so there's some guidance in the application about how long, those videos need to be. They shouldn't be going on and on. But there's some guidance about that. If you wanted to do something oral or, visual, that's fine. But however you decide to do it, we need to have it by June 21st. So, so yeah, you can go to the next slide. So just a bit about what we're looking for. Every area is scored by our selection committee, and I'm not a part of that committee purposely, because I know, people will email me and say, I submitted my thing. I just don't want there to be any bias in the process. And so we're looking for, in terms of background, the ways in which you describe the community, making sure that the research priority that you selected, that you really adequately describe understanding of that issue and some possible solutions, and kind of really lay out the foundation for why you're conducting or wanting to conduct a pilot study addressing that particular area. And really the rest of these are focused on you. Tell us some more about your organization, about the leadership, about your experience, particularly with the research priority that you're picking. In the next one. We also want to know if you have any collaborative partnerships. And again, it doesn't have to be an academic institution, but it could be just your partnerships within the community. And again, just building the case for how you would be able to carry out, in your capacity to carry out the research activities. And finally, yes, looking at, again, your expertise. So these are things that we could see not only from your description, but also from your resumes and things like that, the level of expertise and experience to really get the project done. So once selected, you do go through kind of this onboarding process with Morehouse School of Medicine. This is just routine for everyone who is coming into our system and will need to receive payment. As I shared, Michelle Meadows is our research administrator, and she would kind of, well, not kind of, but she would oversee this process. And so, of course, you would fill out W-9 forms, you would fill out a form to be a vendor within Morehouse School of Medicine. And these are one-page forms. So it's not like you're not getting a book of things. It's just a one page. And we would complete forms to let Morehouse School of Medicine know that you were selected, for this process and should receive payment. Next slide. We will also work on a scope of work, which really just details what I described in terms of the deliverables for phase 1 and phase 2. So it would just talk about you're doing a training, you're doing a one-page summary, you're going to submit your protocol to the institution, to the Institutional Review Board at Morehouse School of Medicine, or if you're working with another academic organization, you can submit your Institutional Review Board application there as well, and just share the approval with us. But anyway, your scope of work is just basically going to detail those deliverables from phase 1 and phase 2. Yep. And then in order to receive payment, you do submit an invoice, and that generally our pilot projects will just submit their invoice at the end of the phase. But you're welcome if you want to submit them on a monthly basis, as long as it doesn't go over the 20,000, you're fine. So, all right. And that is all that I had in terms of content and presentation about the pilot project program, about our center, and about the application. And so now just turning it over to you all, if you have questions that we can answer for you. The only exclusion that we have for the budget is equipment and rental costs for off-site facilities. Because this is community engaged research, we absolutely hope that you're incentivizing and providing compensation for folks who are giving you data. So.
Just to kind of give some, how can I put it? Some resources for anybody else that's doing proposals. One thing I'm tapping into is resource centers, family resources centers. That will help you guys with your budgeting and not having to spend for outside costs for facilities. I've partnered down here with Project Access. So a lot of the things I'm doing here, they have an office already. A lot of family resources centers, instead of you worrying about the cost of your flyers, they will print the flyers for you and add your agency to the flyers. That way you can reach that core community. So I would suggest you guys tap into that too. Because a lot of these organizations, they will let you come in on specific days for you to meet with the people, with the specific community that you're doing. So just want to kind of throw that in just to save some costs and not to have to worry about getting an office or something fancy. A lot of agencies will let you walk in and just set up your table like I have been doing.
Awesome. Thank you, Caleb. We hadn't put a specific percentage on the percent of African-American children and families that are served. But I think that's a good gauge, more than 50%. I think that's a good number if you want to go with that. Hey, Dr. Lawson.
How are you?
Wonderful. Good to see you.
Good to see you as well. I'm really excited to hear about this funding mechanism. I've been working with a group in Atlanta for some time, but we wouldn't be prepared for this round. Will this opportunity be coming up again?
Yeah, so this will be our third, right? So,
Okay.
so we do this every year, have this opportunity for the community pilot project program. So yes, it'll be,
Okay.
as long as everything stays the same with our federal government, we will be back next year
That
and the
sounds
year
good.
after.
That sounds great. That sounds great. Thank you. Thanks for such great information.
Yes,
Great afternoon. And you may have mentioned this. How many projects will be funded?
3.
Three. Okay. And then you mentioned the specific values that we needed to try to align with. Is that in the application or is that on the website?
those are more the values of the center, so to speak. But they are on our website, and we will share the slides as well, so you can have it.
Thank you very much.
Yeah, no problem. And you all read, although the letter of intent is optional and due tomorrow, don't feel as if you can't ask questions anytime after this. Feel free to reach out to us if you have questions as you're working through the application. If you get stuck and, want some additional support, just absolutely reach out and let us know. We're happy to do that. We know that, there's some community-based organizations that just, yeah, may get intimidated by an application process. And so we're happy to walk through and talk you through that. Okay, good question. So I did have a question come to me today about how we define early care and education. And so some folks will think we're just talking about all youth. And that's not the case. When we're talking about early care and education, we're specifically looking at the Head Start, early Head Start age, and before. So maybe 0 to 5 and young families. So sometimes we'll get applications for just folks serving kids and and it's like, yeah, that's good, but they have to really be tied to either early care and education, or like how are we getting to child development or somewhere in that realm, not just children in general. So if it's early care, that 0 to 5 age, that age frame, that's appropriate. That's usually the most kind of misconception is around the children's age. As far as poverty and economic self-sufficiency, we haven't really had many applications come in that space for some reason. Would like to see more, definitely. So yeah, if there are projects around employment outcomes, education and training to lead to greater economic mobility, things like that, would be welcome.
Is there a broader description on the website from what you just mentioned as far as the self-sufficiency?
Probably in terms of probably on our general kind of website in terms of what we look at as a center. It might, I'm not sure if we go into a whole lot of detail in the community pilot project website, but definitely on our general website, we talk about our priorities.
Okay, thank you.
Mm-hmm. Any other questions? All right. Well, feel free to reach out to us. And if you have additional questions, please don't feel like you can't ask. If you get stuck in the process of doing the application and have questions, yeah, feel free to ask us. Constraints about connecting the work to ongoing projects, not necessarily. We call it a pilot project just because it is possibly new for a community-based organization to be doing this type of research, possibly. But if you have some ongoing work, I I don't think it limits you to, not apply for this as well. So I think it's fine. But yeah, please, as you go through looking at the application, looking at materials, feel free to reach out to us if you have additional questions. If you want to just have a session of us helping you work through it, we're happy to do it. We have the funds and we want to give it. We don't want to hold on to these. So please apply. And if you run into any issues, reach out to us. But thank you all so much for your time, and we'll be sure to share the slides and the recordings with you all soon.